Welcome to this explainer. Have you ever wondered if just a few simple bedtime habits could actually help support your prostate health? I mean, if you're over 50 or you find yourself waking up several times during the night to use the bathroom, well, this explainer is definitely for you. We all know that exhausting, deeply relatable frustration of having your sleep cycle constantly interrupted. It leaves you drained, foggy, and honestly feeling like your nights just aren't your own anymore.
Today, we're going to walk through a gentle 5-minute bedtime routine that may help you relax, support healthy bladder habits, and promote overall prostate wellness. Now keep in mind, these tips are based on healthy lifestyle practices, so they aren't a cure or a treatment for prostate disease. But before we dive in, if you enjoy simple health tips for healthy aging, make sure to subscribe to the channel and turn on notifications so you don't miss any future explainers. All right, let's get started.
Section 1. The Nighttime Bathroom Problem. We're looking at nocturia and BPH.
To fix the problem, we really need to understand what's actually happening inside your body when you're jolted awake at 2 a.m. According to the U.S. National Institutes of Health, over 50% of men between the ages of 51 and 60 already show signs of prostate enlargement. And get this, if you look at men over 70, that figure jumps to above 80%. That's a massive number. A lot of guys think this is just some normal, unavoidable part of getting older that they literally just have to suffer through. But science shows us there are absolutely natural ways to manage the symptoms.
It usually comes down to two overlapping conditions. First, benign prostatic hyperplasia, or BPH. This is a non-cancerous growth of prostate tissue. Because the prostate sits right below the bladder and surrounds the urethra, an enlarged prostate literally squeezes the tube that carries urine, and this leads directly to nocturia, which is just the medical term for frequent disruptive nighttime urination. But hey, it's not just structural. Stress triggers your body's fight-or-flight response, dumping adrenaline and cortisol into your system. This actually increases pelvic muscle tension and makes your bladder hypersensitive, creating that intense, urgent need to go.
Section 2. The 5-minute bedtime routine. Actionable steps for a calm bladder. So, how exactly do we counter both that physical pressure and the nervous system tension? Well, we do it by introducing a highly specific, evidence-based routine. Step 1 begins exactly 1 hour before bedtime. Try to reduce your intake of fluids during this last hour before you go to sleep. Now, this absolutely doesn't mean you should become dehydrated. You still need to drink enough water throughout the day. But easing off before bed, and specifically avoiding bladder irritants like caffeine and alcohol in the evening, prevents fluid from pooling in your bladder right when you should be resting.
Moving right along to step 2, take just 1 minute to practice slow, deep breathing. Sit comfortably, close your eyes, and follow this rhythm. Breathe in deeply through your nose for 4 seconds. Hold that breath for 2 seconds, and then slowly breathe out through your mouth for 6 seconds. You just repeat this several times. Relaxation directly reduces stress, and doing this for just 1 minute actively lowers your cortisol levels. Remember, stress can worsen urinary symptoms in some people, so ending your day with calm breathing is genuinely good for both your mind and your body. Step 3 is gentle stretching, and this is where that whole mind-body connection really shines. Spend about 2 minutes doing light stretches for your hips, lower back, and legs. Think of mindful movements, like the child's pose or the happy baby stretch. Gentle movement before bed may help reduce muscle tension in the pelvic floor, which can actually mimic the sensation of a full bladder. Just make sure to move slowly. And remember, never stretch to the point of pain.
Next up comes step 4. Empty your bladder just before going to bed. But here's the secret. Don't rush it. Take your time. Try what's called a relaxed double void. This means you urinate, stand, and breathe for about 30 seconds, and then gently try again. Taking your time to allow your bladder to empty as completely as possible significantly reduces the likelihood that you'll have to wake up in the middle of the night.
Finally, we have step 5. Aim for 7 to 8 hours of quality sleep. The crucial point here is that good sleep isn't just a timeout for your body. Deep, restorative sleep supports hormone balance, immune function, and your overall health. That hormone regulation actively reduces overnight urine production. Keep your bedroom cool, dark, and quiet, and really try to go to bed at the exact same time every single night.
Section 3. Daily habits for prostate health. What you do during the day absolutely matters at night.
You see, you can't just ignore your prostate all day and expect a 5-minute nighttime routine to work miracles. Your daylight hours form the total foundation for your nighttime comfort. First, stay physically active. Even a 30-minute walk most days of the week provides huge benefits for your overall health. But here's an incredibly surprising fact from the research. Taking just a 15-minute light walk right after your meals can drastically improve cellular oxygenation in your pelvic region. One study actually showed that men who walked for just 15 minutes after lunch and dinner had a 35% lower risk of developing severe BPH symptoms. It improves blood circulation and actively reduces inflammatory markers. Nutrition is equally vital. You want to eat a balanced diet rich in vegetables, fruits, whole grains, beans, nuts, and healthy fats. 2 foods to specifically highlight on your plate are cooked tomatoes and pumpkin seeds. Tomatoes are packed with a natural antioxidant called lycopene that directly targets prostate inflammation. And pumpkin seeds? They provide essential zinc to support the structural health of the prostate gland itself.
Furthermore, maintaining a healthy weight is critical since excess body weight has been heavily linked to a greater risk of urinary symptoms and systemic inflammation. Oh, and if you smoke, you really need to consider quitting. Smoking directly affects your blood vessels and your overall health in so many ways, effectively restricting the healthy blood flow that your pelvic region needs to function properly.
Section 4. When to see a doctor. Recognizing medical red flags. While these lifestyle habits are incredibly powerful, it's also important to know when to see a healthcare professional. We need to clearly separate typical symptoms of aging or stress from urgent medical red flags. A gradual increase in urgency or nighttime waking is pretty common with BPH. However, if you ever notice blood in your urine, severe pain, difficulty passing urine, fever, chills, or urinary symptoms that just continue to worsen, do not ignore them. Seek medical advice promptly. Regular checkups are especially important for men over 50 or earlier if you happen to have a family history of prostate problems.
Remember, there is no single exercise or routine that can prevent or cure prostate disease. The best approach is always a healthy lifestyle combined with regular medical care when needed. So, let's do a rapid-fire review of today's 5-minute bedtime routine so you can memorize it for tonight. 1. Reduce fluids in the last hour before bed. 2. Practice 1 minute of slow, deep breathing. 3. Do 2 minutes of gentle stretching. 4. Empty your bladder completely using that double void method. And 5. Aim for 7 to 8 hours of quality sleep. Small habits, repeated every single day, can truly add up over time. So I'll leave you with this thought. Are you ready to take just 5 minutes tonight to reclaim your rest and proactively support your prostate health? If you found this explainer helpful, give it a big thumbs up, subscribe to the channel, and please share it with a friend or family member who might benefit from a better night's sleep. Thanks so much for watching, and I'll see you in the next explainer. Stay healthy and take care.